dedicated budget, and same should be done to essential health services.
This year's International Women's Day celebration is coming at a time when the world is grappling with the COVID-19 pandemic. According to the World Health Organization, the maternal mortality rate of Nigeria as at 2020 is 814 per 100,000 live births, and the infant mortality rate is 59 deaths to 1,000 lives. Over the years, VE's coalition of women leaders under the Partnership for Advocacy in Children and Family Health at Scale project have been challenging public officials to keep the promise of prioritizing essential health services.
As CSO leaders of the Pact for Scale project, we have done the research and know the reality on the ground is one where adequate funding is not made available for essential health services. We also know that even when funding is allocated, it's seldom released in a timely manner. Moreover, while there are clear and dedicated budget lines for COVID-19 related expenditure, budget lines for essential health services such as routine immunization are not separated. Rather, funds for routine services are merged together in bundled up and opaque lines, labeled in some states as counterpart funds.
They appeal to the government to make maternal and infant mortality a prime consideration.
As a people, as a government, we need to improve our services to ensure that infant mortality and maternal mortality are brought to the barest minimum.
For the president of National Council for Women's Societies, the pandemic impacted both negatively and positively on women.
Before the COVID, women used to go to places to get family planning, either to their private doctors or to family planning clinics and so on and so forth. But with the lockdown and with the health people busy with the COVID-19 pandemic, there was no way they could get their family planning. And of course, the men are at home. And you know what happens. And we are talking about population outbursts. But the positive part of it was that, well, we were challenged to know how to work from home. People started working from home. People started trading from home.
As the world marks the International Women's Day, these women leaders expect the government to match words with action and provide adequate funding for essential health services.